I'd like to welcome everyone to the November meeting for the Pitt County Board of Health. We're sorry for the delay. We had some unanticipated technical difficulties. At this time, we'll call the meeting to order, and we'll start with a roll call attendance.
Tom Colson, Tina Dixon,
Present.
Martha Engelke,
Present.
Rex Fleming, Mark Hayes, Scott McIntosh,
Present.
Natish Patidar,
Present.
Kelly Pack-Smith,
Present.
and Lowell Spate.
Present.
Thank you.
Our first order of business will be the swearing in to the oath of office for our new member in the physician role, Dr. Herb Garrison.
Repeat after me, sir. I, Herb Garrison, do solemnly swear
I, Herb Garrison, do solemnly swear
that I will support and maintain the Constitution and the laws of the United States
that I will support and maintain the Constitution and the laws of the United States
and the Constitution and laws of North Carolina, not inconsistent therewith,
and the Constitution and laws of North Carolina not inconsistent therewith,
and that I will faithfully discharge the duties of my office as a member of the Pitt County Board of Health
and that I will faithfully discharge the duties of my office as a member of the Pitt County Board of Health
to the best of my skills and ability according to law, so help me God.
to the best of my skill and ability according to law, so help me God.
Thank you.
Thanks.
Sir, you can take the chair.
Welcome on board, Dr. Garrison.
Thank you.
At this time, we'll hear any public comments. And seeing none, we will review the minutes from the October meeting that have been previously circulated to the board members. Any questions or discussion or changes, please raise your hand. We'll seek a motion to approve.
I approve, or I move that we approve it.
Got a motion from Dr. Hayes and a second from Kelly Pack-Smith, it appears.
Yes, I second that.
And the minutes are approved. Next, we'll move on to the fiscal report with Marcia Hall.
Yes. Hey, everybody. Can y'all hear me okay on my mask? Okay. We are looking at the period 4, ending of October 31st. It was a very busy month. We received $665,000 in state funding. The majority of that was COVID related. It brings our overall budget to $13.141 million. If you keep going across our report here, year to date, we are down in some areas, which is expected. Medicaid is off around $48,000 at the moment. Some of that is related to our clearinghouse with adding Dentrix. We had to create another NPI. But that is due to our services. We are only doing mandated services that we are required to do by the state. We're still hoping that in the next phase of reopening, we can add back our services. If you put in the average state funding that we get back and the county payment that is owed for this quarter, we are at a surplus of $692,943. Does anybody have any questions?
It appears not.
Okay. I just wanted to show you our grant status at the end of October. We still have several grants. Some of these grants have had no movement because they are, particularly the committees that govern these grants have some of our community members, and they have not met, and therefore some of their programs, such as Pitt Partners for Health, and the adolescent pregnancy grant that Vashti does in the schools, they have not been able to spend that money, so they have been at a standstill. But at the end of October, we have $393,000 roughly in our grant funds. Just wanted to mention that to you. Also, vacant position status. This is as of the 9th. I updated this so that there was a couple of positions that we had listed, and due to funding sources, those positions, the county, if you have a grant-funded position and that grant goes away, the county does not pick up that grant, only in certain circumstances. So we looked at that, and you'll see where I've added the asterisk not included in the total, and that is because the funding either ended or grant funding, and just wanted you to have a snapshot of all of the positions. But they're in various stages of interviewing, on hold, frozen, but we have 21 vacancies. I have some more notes, but other than the fiscal report, that is.
Okay. Let's go ahead and approve or seek action on the fiscal report that Marcia gave. So look to a motion to approve the report. Dr. Garrison has a motion to approve, and it looks like Tina Dixon, unless she has a question, has seconded.
I'm seconding it.
Great. Any other questions? It looks like not. So the fiscal report's been approved, and now Marcia has another point of discussion.
Yes, I just wanted to give you a few updates. Retrocade, we have been working with the Vidant team. That is running in the background of Epic, and we are glad to say that that has actually brought us in. It doesn't sound like a lot, but we didn't really have to do a lot to refile, but that's $250 within just a few days of this code that they dropped in the back of Epic that we were able to go back in and refile Medicaid claims. So we're super excited about that, and I look forward to keep reporting on that. Consistent with the Federal Department of Health and Human Services, the extension of the federal COVID-19 public health emergency has been extended to January 21st, 2021. That is the temporary provider rate increase and the clinical coverage policies will remain through that date as of right now. So that's a 40% increase of our Medicaid fee that we're filing for. The desk audit for the Medicaid cost study, fiscal year ending 2017, we received a check for $131,872. And if you remember, when we file the Medicaid cost study, they keep 10% of the possible findings and anything else that we possibly refile in between when we submit the documents and when they pay for that fiscal year. So that is an increase. Super excited about that. Dentrix, we had a file conversion today. We've been working through those bugs with Dentrix, and we've been working with the MIS department. They've been great. We had to create a new MPI for our Dentrix payment so that when they come in, it's separated. Before, the dental payments all fell under the MPI of the Pitt County Health Department. So there's just been some nuances with the new software that we're having to work through, and hopefully some of that Medicaid decrease that you see will be up next month when everything starts clearing through the clearinghouses. The Medicaid cost study for 2019-2020 has been submitted, and we're also just started working with a company called Forte. Forte is a system that's already in place with the Pitt County Tax Office. It is a online system so that hopefully we will be able to move to an online payment system for our environmental health permits. Right now we have to, either they have to pay in person, which there's a big time delay if they submit the application via mail or come in with COVID. So a lot of our customers are asking for it, and it will help improve our operational improvement. And that's what I have for admin notes.
Thank you, Marcia.
You're welcome. And I think I have the next.
You do.
Sorry about that.
You go right ahead.
This is an annual, we write off our bad debt every year. And this year we have 95 accounts equaling $15,455.15. These accounts have had no activity for at least a 2-year period. This will help the county save some postage and expense from mailing the statements. Quarterly statements we send to these account holders, many of which no longer have current addresses. Any delinquent account over $50 we have, if we have a valid Social Security number, is sent to the North Carolina Debt Set-Off Clearinghouse for possible collection. And this applies to the accounts that you write off and active accounts. And just so you know, any account that we do write off, if that client comes back to the health department, we reactivate their accounts to receive payment. But this is an annual business item that we have to write off for bad debt.
You need us to take action to approve that.
Yes, sir.
So we will look for a motion to approve the bad debt write-off for this year.
Actually, I had a question. Or
Yes,
you gonna say
absolutely.
questions later? I'm sorry, questions now or later?
Yep, you go ahead. Right, let's do questions
Yeah.
now.
Okay, so my question, Marcia, is this typical for our bad debt write-off? Is this higher or lower than our usual?
This is actually the second lowest that I could find in my research. If you remember, I'm not sure if you were part of the board, last year we wrote off an astronomical amount because we had, when we were going over to Epic would not allow us to move all of our former accounts in HIS into Epic because those services were not done in Epic. So we wrote off $539,000 last year, and that was over 2 years. Although some of those accounts we still get payment from, but that was because HIS, I don't know if y'all remember why we moved to Dentrix, HIS is breaking. So it's not a very secure system that we can use for payment collection. We're still using it. We still are making payments on it, but the state does not support that program as much as it should. All of this is in Epic at the moment. So it ranges from anywhere from 43,000, and another year in 2012 there was $206,518 of bad debt. But it has in 2015 it was as low as 13,000. So it's random.
It's still a pretty low year, though.
It is a very low year.
Yeah.
And I contribute that to Epic, and I contribute that to our business team. They are knocking it out the ballpark. Epic does, things go into the work queue, and we're able to catch certain things. And, I mean, we're still learning things about Epic. It's a learning process. And every time they do an upgrade, sometimes we have to research and do other things. And we're actually are working on building more reports for these kind of situations.
Any other questions?
I feel like I'm screaming with this mask on, so I'm sorry. I know, I feel like.
All right, we'll seek a motion to approve.
So move.
Second.
All right, so that has been approved for this year.
All right,
Uh,
thank you,
Thank you, Marcia.
appreciate it.
Next, we'll have Dr. Kimberly Hardy up for a COVID-19 testing and vaccination program update.
Good evening.
Good evening.
Okay, I'd like to briefly update you on the COVID-19 testing, community testing project that we've been running since July 9th. As of Friday, we had tested 8,598 people since July 9th. Of those tests, 7,922 were negative, 676 were positive, which gives us a COVID-19 testing project positivity rate of 7.9%. I say that slowly because that has nothing to do with our county positivity rate. We have people that come in from out of county. We've had some people coming in from out of state who have been tested in our clinic, in our curbside testing event. Just to give you a visual of 8,598 tests, 676 were positive, 7.9% positivity rate. This is busy, but it gives you an idea of the trending nature of our testing project. In the beginning, we started out with testing 1,647, performing 1,647 tests the first week. And as you all know, we were at 8 sites, or actually 7 sites that first week. And then as time has gone on, we have continuously trended down. We had the lowest testing total last week at 143 tests. The positivity rate, as you can see, has kind of been all over the place, with last week being 7%. And this is just visual to show you the difference between phase 1, which lasted 5 weeks, and we performed 5,213 tests, and then in phase 2, performing over a 12-week span with 3,385 tests. Our numbers have decreased some with our testing, as other sites have been doing testing. I didn't point it out when I was on the slide, but the positivity rate has been higher in phase 2 than it was in phase 1. So in summary for this project, October 20th through December 17th, 2020, drive-through testing schedule continues to run on Tuesdays from 1 to 4 p.m. and Thursdays from 9 a.m. to 12 p.m. We did make a modification in our testing due to concerns with staff safety. We changed our hours on Tuesday afternoon to avoid being out on the curb after dark. And also realizing that the addition of community testing sites has impacted the volume of patients that we've been receiving. And just of note, our case investigation and contact tracing efforts still continue. Any questions about that part of the project? I don't have any data at this time regarding the demographics or repeat testers, that type of thing. Literally, we haven't really had the opportunity to do that. We do not have a data manager, so to speak. Moving on to the next project, in the midst of the COVID life, we have successfully completed the Pitt County Health Department middle and high school drive-through immunization clinic project in October. Actually, before even October, last year we began meeting with Pitt County Schools, area pediatricians, the clergy, and I'm drawing a blank on the group that worked with us from the interfaith community. But we had a lot of collaboration across the public health system to address the issues with children not being vaccinated last year. This part of the plan was the last part of the action for 2020. It was certainly complicated by COVID-19, but we were able to pull it off. We've been meeting with Vidant School Health, Pitt County Schools, Pitt County PIO, National Guard, and several divisions within Pitt County Health Department to make this project successful. Our goal was to implement 4 drive-in immunization clinics at the Pitt County Health Department on the curbside, actually where we do our COVID-19 testing. And our number, we actually increased our number of target was 400 students, middle and high school students who were delinquent for immunizations. And our target date was October 30th, which was the date that Governor Cooper had given us in terms of that being the last deadline for the children to be able to remain in school. We had approximately 19 staff committed to this project, a processing assistant, 10 registration staff, and 7 to 8 nurses per day. We could not have accomplished this without the collaboration with Vidant Health Program, School Health Program. They actually supplied us with the majority of nurses that we use for this project. Our outcomes, we actually ended up holding 5 clinics. We added an additional day on November 2nd when we had the highest volume of students show up that Wednesday prior to the deadline. We immunized a total of 196 students. We had 405 appointments available, and 209 appointments were made. So we had about 41.7% appointment utilization rate and a 94.6 show rate, which was, the show rate was phenomenal. The appointment utilization is very low. So lessons learned from this project is that we have several factors that have impacted our children being able to be immunized, even though we're a little bit late in the game in terms of the deadline. The public health system collaboration was absolutely phenomenal. Even when we had technology difficulties, the collaboration with Vidant School Health was very helpful to help make sure that we had children's up-to-date immunizations when reports when NCR was not available to us. The timing of clinics in relation to the impending deadline of October 30th, I think, was probably the single most important factor in terms of people coming in. Our barriers, obviously, is COVID-19 pandemic and its impact on access to care within our health system. Parental engagement, I must say again this year, as it has been for 25 years that I've been doing this work, is still an issue. Despite the public information and marketing that has been done, we still have a little over 700 students who are delinquent on vaccinations right now, as of today, looking at our spreadsheet. And probably one of the single most barrier, I think, for this project was that on Friday, October 30th, it was, Governor had extended the deadline from October 30th to December 30th. While we had such momentum on Wednesday, we believe, we don't have hard data of this, but we believe that when parents learned they had more time, they took that time. So on Monday, we had 120 appointments available, and only 27 people came for vaccination. It was a little disappointing. One of the things that we did learn is that we need to keep offering services the way that we do to reduce the loss of resource, financial, and staff time. Our optimal time for service delivery for well child checks and for immunizations for a population that's underserved is going to hold true for what it's been, which is about 7 to 10 days before the actual last deadline. Any questions?
Dr. Hardy, do you think that the option that parents have for middle and high school for their students to be virtual only for a semester, do you think that's had an impact on parents saying, well, they're not going to be in school, why do they need to go run and get an immunization?
I think it has, and I think that the thinking on that is very focused to their own environment. They don't know what we know in terms of the importance of having the majority of the population immunized. Our immunization efforts are not helpful if they're not above 95% of the population. So it puts our community at risk.
Sure.
And I think the thing that's most there's a few things concerning about that, one of which the strain of the public health system with doing contact tracing and treatment for vaccine-preventable diseases in a system that's saturated and focused on COVID-19 right now. But also many of the diseases that the vaccines prevent mimic or have similar symptoms of COVID-19. So if I had to say anything as a nurse appealing to parents, moms, and fathers, I would encourage us to keep our children vaccinated and on schedule. When they make appointments with their healthcare system, please keep those appointments. When they don't show up, it's a loss. We have staff that are standing and ready to provide the care, but when they don't come, it is a loss for our entire community, and particularly for their children's health.
Sure. Thank you for that. Looks like Kelly Packsmith may have a question.
Yeah, thank you. So I was actually thinking the same thing that you were thinking of as far as virtual school and that being a barrier. Furthermore, I wonder how much transportation has to do with their ability to be able to access the service at all. Because I presume that the vaccinations are happening at the health department, not on site at the schools, right?
That's right.
Okay, and I just wonder if, not that I don't totally disagree with the need to make sure that our children are vaccinated, I just wonder what the other barriers are for parents to be able to get their kids there.
I wonder too. We've made the access a little simpler. Being on the curb, not having to come in the building. They did have to make an appointment, but many of the people who came without an appointment. We were able to work them in. I think right now, this year, the biggest barrier is COVID-19 and the lack of access to care, because many of our practices have had to close or reduce our capacity to help make sure everybody who comes in is safe.
One other question I had, Dr. Hardy, was of the 700 delinquent students in the system, do you know how many, or percentage-wise, had contact made to, hey, you're behind, we need to get you in?
I would dare say 100% of them. We have collaborated very closely with Karen Harrington and Pitt County Schools PIO officer, and they have sent out notifications. School nurses have sent out letters. The notifications have been repetitious.
Sure.
We've actually had some people come to the vaccination clinics who didn't need a vaccine. They took the warning seriously and came out, which was wonderful. But yeah, I believe every one of those students something was sent home with
Sure.
them. Whether it made it to the parent or not is questionable, as it is with children sometimes. But all of the children, I would say, from our conversations with Pitt County Schools and the job that they've done, they've all received notification.
Thank you. Any other questions for Dr. Hardy?
Can I say one more thing?
Yes, ma'am.
While the deadline is December 30th, the access to care is not until December 30th. Many practices are closed during the holiday
Sure.
for a few days. So it sounds a little deceiving to think that you can call today and be seen by December 30th, or call December 1st and be seen by December 30th. And I think that's one of the biggest misconceptions with our parents, is not understanding the time frame, that when you call a doctor's office and you have an urgent need, it is not an urgent or a healthcare crisis, and it has to fall in line with the usual scheduling protocol.
Urgent, not emergent.
Right. Oh, thank you.
Thank you so much. Next, we'll move on to our Health Director's report with Dr. Silvernail.
Pardon my slowness, I've got a sore calf tonight. Too much physical activity this weekend. I am going to, just so you can hear me clearly, good evening, Dr. Harrell, good evening, other board members. Welcome, Dr. Garrison. Good to see you, Herb. General updates: the direct and indirect effects of COVID continue to consume the efforts of Pitt County Health Department. COVID-19 testing is broadly available across Pitt County. I'm going to show you some data to support that. The Department of Health and Human Services and Pitt County Health Department sponsored surge testing site opened on Monday. We've done a very soft opening with this site to work some of the bugs out of the site. So far, things have worked well. We tested at that site a little over 20 people yesterday. I did not hear a number for today. We did not advertise that, again, because we wanted a soft opening, but word of mouth and signage has brought in folks there. We will put a press release out later this week now that we've got some of the kinks worked out of that and are ready to open for more people. We do have a small blended unit from the Guard assisting with our testing and vaccine operations. They are part of that federal surge testing site. They were sent to us ahead of the surge testing site open so they could work in our testing site and learn how to run a field testing site. They were a big asset, as Dr. Hardy mentioned, during our vaccination and our own COVID testing at the health department. They're blended in that there are airmen and U.S. Army National Guard folks in that unit. I'm going to move through by division. Health education. Our COVID hotlines continue to remain active. They are open from Monday through Friday from 8 a.m. to 5 p.m. Right now we're currently answering about 40 calls per day. We are working on a presentation to describe and quantify that work and hope to have that ready for you all for next month. Personal care, clinic, all mandated services remain available. Again, some of those are being done in a blended format, a mixture of telehealth and in-person visits. Vaccine preventable diseases, as per Dr. Hardy's report. Great job by her and her team on that. I will mention, in response to Kelly Pack-Smith's question, we do know that transportation comes up again and again in Eastern North Carolina as a barrier to medical care, all forms of medical care. So yes, that probably plays a role in access to vaccine for some of our school children. We had planned to try to catch some of these kids on the way out the door at the end of the school year last year, but with the abrupt end of the 18-19 or 19-20 school year, we were unable to do that because on Friday we thought school was still going to be open on Monday, and then their schools were closed over the weekend, so there was no opportunity to try to catch some of these kids on the way out the door at the end of the school year and get them for their vaccines needed for the next year's class. Communicable disease, we are all about COVID. And let's see, Carla, did you put my slides up here somewheres? There we go. And so if we can switch over to that, I'm going to run through these. Normally I use the state website when we do these. Every week the North Carolina Communicable Disease Electronic Surveillance System sends me a report of cases across the county. This was a table that Dr. Hardy had in her report showing our testing, which began in July, running through last week. And you can see the steady decline in numbers tested there. This is what the NCEDIS, North Carolina Electronic Disease Surveillance, says we've got in terms of testing. You can see the growth in that across Pitt County. So the decline in our testing is likely explained by the growth in other testing services across Pitt County. If you look back at the last 4 to 5 weeks, you can see that we're generally in the 4,000 or 4,000 plus range per week across the county, including all providers. So in any 1 month period, we're testing in excess of 20,000 individuals in the county. The state guidance on that was that we should be testing about 5% of individuals in Pitt County every month, and that would be about 9,200. So we're doing in excess of 20,000, more than doubling the state recommended numbers for testing in our community. This shows that same testing graph with the percent positivity line drawn in as of this morning, or as of this afternoon. Our cumulative Pitt County positivity rate was 5.8%. In the spring, when we were tracking that, we had stabilized at about 7%. Right now, we've been stable at about 6%. Sometimes we're a couple of points below, sometimes a couple of points above, but a full percentage point better than we were in the spring on our returning positivity rate. The spike in the middle is the ECU spike, and I don't mean to keep picking on ECU, but we did have that ECU bubble. A couple of other looks at our data over time. This is through October 31st, or Halloween. This shows cases by earliest, date of earliest illness, identification, and age. And you can see that the biggest group in this became the 18 to 24-year-olds in that surge, the college surge. The older age group, the 75 and older, remains really one of the smaller groups in this. And the point I would make too is, you look at this, the three highest columns represents the week, represents the time frame of the ECU surge or bubble. Before that, you can see the big step up there about July 11th. You can see there's kind of a step up, July 18th, a step up. Some of that was the start of our testing program. And, we do find cases in direct proportion to the amount of testing that's out there. And then on the back side of the ECU bubble, you can see again we're pretty level in spite of increasing testing. So I do think that that's reassuring that even though we're testing more, our numbers are remaining level and our percent positivity rate seems to be trending down a bit. This graph shows it by congregate living, and you can see the end of May and beginning of June we had an outbreak at one of our long-term care facilities. We went kind of quiet through the end of June and most of July, getting into August, and we had some activity through August, which has gone away. We continue to have some slow, smoldering outbreaks. In order to close an outbreak in a long-term care facility, we have to pass through 2 incubation cycles or 28 days, which is 4 weeks, to be able to call that closed without a case. So we'll get some of these. We'll get almost to that 28th day, and we'll get 1 new case in an employee or a resident, and then we've got to keep that open. So we continue to have some smoldering there, but I think overall we've done a good job at keeping this out of our long-term care facilities or controlling in our long-term care facilities. The blue line, the blue part of the graph is the non-congregate living. Pink or salmon, whatever color you'd like to call that, is the congregate living setting. This is distribution by race and ethnicity. A lot of data in there. Early on in this, African Americans were a large percentage of our case. At one point, something like 56% of our cases. As time has gone on and this has continued to burn through our community, this is stratified out closer to matching in terms of a racial distribution, the makeup of our community, although African Americans do represent a fairly large amount of that data still. And that's the end of those slides. Questions about the data from anybody?
Any questions from the board members? I see none.
Okay, a couple more points to make for you all. Our WIC program, the WIC waivers that we've talked about in the past have been extended now through February 20th of 2021. We'll see what happens after the new year with those. Our WIC caseload increase is 4,013, so 97% of that is 4,378. So we are well above our minimum requirement for WIC. Our nutritional services line, November, asked me to remind you that November is Diabetes Awareness Month. As such, we are hosting a virtual event. That event will be held on November 18th from 3 to 4:30 p.m. The title of the event is The Right Prescription. We'll feature Dr. Mishriki. Forgive me if I didn't pronounce that correctly. He'll be the presenter for that session, and they will have a healthy food demonstration done by Lachey Ponder, and she did a test run of that today and provided samples, and I will vouch that they were very good. She made sure that I had a sample and had to quality control that today, so it was very good. Moving on to finish up our environmental health division, we continue to search for a new division director for environmental health. Our food and lodging staff remain very busy with inspections. Our on-site wastewater folks are busy with new developments, new housing being built here in Pitt County. Marcia hit our finance and administration. I have nothing to add there. An issue that Marcia did bring to my attention late this afternoon, we've been notified by our supplier there's a national gloves shortage. Now, I don't know if you've heard that at the hospital or not, Herb, but apparently we can buy only limited quantities of gloves each week. So we will continue to do that and try and maintain our supply of gloves for operations. And that's my report. Happy to take any questions from board members.
Any questions for Dr. Silvernail from the board members?
Just a comment, Dr. Misricki, he is a graduate of our diabetes fellowship and just does fabulous research. I think the group will really appreciate hearing from him.
Great. I have not met him personally. But. All right, I thank you for your
I
attention.
see no other questions. Thank you, Dr. Silvernail. At this point, we will look for action to move into a closed session. And If we have a second, we will then have Ms. Dixon read our general statute.
Thank you, Mr. Chairman. Motion to go into closed session in accordance to North Carolina General Statute 143-318.11, Section A, subsection 1, to discuss personnel matters that are privileged and confidential pursuant to North Carolina General Statute 126, Section 22. Thank you.
She has a motion. Do we have a second? Dr. Hayes and Dr. McIntosh. All right, at this point, we'll move into a closed session. And it looks like we're back from closed session. If there are no other new business points, we will look for a motion to adjourn the meeting.
So moved.
Dr. Garrison has made a motion. We'll look for a second.
Second.
And the meeting is adjourned. Thank you guys so much, and we'll see you in December.